Right. So if you have read and understood, considering its surgical pathology station, kindly tell me what is your provisional diagnosis?
Considering the scenario, my provisional diagnosis is maybe pancreatic islet cell tumor like gastrinoma,
Yes.
and as it's associated with a history of hyperparathyroidism, it may be multiple endocrine neoplasia type 1.
Okay. How would you define the term hyperplasia?
Hyperplasia is the event with increased number of cells, normal
Okay.
cells.
What microscopic picture do you expect in hyperplasia?
In microscopic, under microscope, there will be increased number of normal looking cells.
Yes. And
And
anything else?
the there may be
What is the something island and
oh, okay, ma'am.
instrumentation?
Island cell. In case of island cell, if there are different types of islet cell tumors like gastrinoma, insulinoma, and according to that, there may be a particular cell type present,
Okay,
like beta
microscopically,
cell if insulinoma.
you'll most commonly see chief cells, hyperplasia. So they are like multinodular, diffused, etc. Less commonly, second
Ma'am,
one will
that's in
be,
hyperparathyroid.
oh,
That in case of parathyroid.
okay, but like I was, one of the differential diagnosis you were telling, I was asking in that. Okay, all right. Can you tell me how many parathyroid glands are there which can be
The
affected?
4 in number.
Okay. Can you tell me, other than these symptoms with this patient has presented, what lab investigations would you ask for?
According to the scenario, I will go for checking patient's blood glucose level, patient's serum insulin level, C peptide level, and also the blood glucose and insulin ratio.
Okay, coming back to insulin ratio, if you can tell, the patient develops stupor, confusion, and hypoglycemia. What might be the cause?
It might be due to diminished blood glucose level,
Yes,
and it if it's precipitated by exercise or fasting, and uh, and improved by taking meal or by IV glucose intake, then it may be a case of insulinoma.
yes. If patient is unresponsive to hypoglycemia, then it could be because of,
Unresponsive to hypoglycemia,
yes.
it may be due to people's and that's also due to
There could be,
insulinoma.
yeah, but there could be ectopic production of insulin somewhere else.
Ectopic, yes, ma'am, from
And
any retroperitoneal fibroma.
okay, can you name few other conditions that can also lead to hypoglycemia?
Yes, ma'am. There may be one of the cause may be ectopic production of insulin from any sarcoma or retroperitoneal tumor, and there may be abnormal insulin sensitivity, and there may be any kind of liver disease
Yes.
or inherited glycogenesis.
Yes. Can you please define the term Vipstroid?
It's a is the constellation of several symptoms like confusion, stupor, coma, which are produced, which are precipitated by fasting or exercise, and improved promptly by feeding or parenteral glucose intake.
Can you name the genes which are involved in insulinoma?
Yes, there may be menin gene in chromosome
Yes.
11
Yes.
mutation, and some other genes also like P10 TSC2 gene mutation. These are tumor suppressor genes.
What is the normal level of insulin that you'll come across or you should expect?
10 micro mole per liter.
Okay. So what would be the blood test that you'll ask for to diagnose insulinoma?
Blood glucose, serum insulin, serum C peptide, and insulin to glucose ratio, and also imaging where here CT scan is already done.
Yes.
And we can also, if it's confirmed, we can after confirmation, to stage the tumor. I can do also endoscopic ultrasound.
Yes. Okay. Can you tell me how would you differentiate MEN1 from MEN2 syndrome?
In case of MEN1, there are commonly they commonly present with hyperparathyroidism, pituitary adenoma, and pancreatic islet cell tumors. These are commonly present together. And in case of MEN2, there are 2A and 2B. In case of 2A, they are associated with medullary carcinoma of thyroid and pheochromocytoma along with parathyroid adenoma. And in main 2B, along with this, there are also Marfan syndrome and mucosal neuroma.
All right. Can you please tell me what are the genes that you expect to find in MEN2 syndrome?
In main 2, there are red gene mutation,
Yes.
red oncogene mutation,
Okay, then
present in chromosome
yes,
10.
the term gene. Can you define what is telomere?
Telomere is the presence of repetitive nucleosomes, repetitive sequence of
Nucleotide.
nucleosomes nucleotides at the end of the chromosomes
Yes.
that actually protect the chromosome from chromosomal ends from deterioration and prevents the mixing up with the other chromosome.
Yes. Okay. Can you please define the term apoptosis?
Yes, it's a programmed cell death that occurs usually in a physiological condition.
Okay, can you tell me how would you consider apoptosis a physiological process?
When certain extrinsic or intrinsic damage to cell causes the DNA damage, then there are signals called there are some tumor suppressor genes that cause actually arrest the cell growth of the damaged cell with the damaged DNA and tries to repair the DNA. And if fails to repair the DNA, it causes the programmed cell death, apoptosis.
Okay, so can you give the example in case of like gene that protects against apoptosis, interleukins, and genes that promote apoptosis, P53. So these are the examples which explains your definition.
P53 is the yes.
Yes, good.